I'm Nikki Embrey and I was an MS specialist nurse at the Royal Stoke Hospital for 21 years, and I'm now doing some work for the MS Trust.
Which we are very excited about. So could you tell me exactly what does an MS nurse do?
Well, historically, it was all about setting up services, about mapping pathways to find out where the difficulties lay with patients coming into clinics, setting up clinic services, developing home visits, looking at the relationships between community working and the hospital. Nowadays things have changed somewhat in that some MS nurses will be based within the hospital environment, within the acute trust, and others will be based out in the community. There are also now different bands of MS nurses, so the band 6s may have a slightly different role than the band 7s, who are more advanced MS nurses.
So here's a question. When should you contact your MS nurse?
Well, after seeing patients in the newly diagnosed clinic, the final words really were to contact us if the patient was worried about anything. Obviously, priorities to the MS nurse would be someone in relapse. So if someone is having a relapse, the day that they contact us, we like to get back to them either that day or the following day, because obviously, as the NICE guidelines stipulate, really the window frame for treatment of a relapse, if it requires treatment, is 14 days. So you want to get the patient seen as soon as possible. However, saying that, you need to triage the patient through the telephone consultation, first of all, to rule out any other problems that it may be related to, rather than it being a relapse. But with respect to contacting us, if the patient is worried, I would much prefer them to telephone us. The secretary would take the details of the call and then we would prioritise that case. It may take several days to get back to someone, but if you're worried about symptoms, you're worried about progression, you're in relapse, then that is the time to contact us, or if you have worries that are concerning you, because obviously that could have an effect on their MS.
Yeah. So for people who are working and have MS, but they haven't actually told their employer and they feel a bit worried about it, is there anything MS nurses can do to help them with this?
We do sometimes contact employers if the patient is in agreement. Obviously, confidentiality, you would need the patient's agreement to do that. But from an employment point of view, a lot of people with MS don't actually tell their employers. There are certain aspects of their employment, though, however, where they may need to inform the employer. And these are, if they work in the armed forces, they should tell their employers that they have been given a diagnosis. And they may require further information, and then we would get involved as well in writing letters if that was appropriate. Also, if somebody is driving for their work, particularly HGV drivers and taxi drivers would need to inform their employers, or anybody who is using their work's employer's insurance to drive. And then again, certainly people who do require some adjustments to the work environment, it would be better to explain to their employers that they have been given a diagnosis of MS and possibly what readjustment is required to enable them to continue working. People do get very worried about letting their employers know, but if they have any of those legitimate reasons for informing them, then they would have to. But they also need to remember that there are, from a legal perspective, employers need to keep their employee in work, and people with MS have a legal requirement to stay in work. So the law is on their side basically, but again, some people do get particularly scared. There has been some research done, in fact, that says that if people do tell their employers about their MS fairly early on, they generally continue to work for a lot longer than people that don't inform. But again, I would say talk to your MS nurse if you need any support from them or from the consultant neurologist. Then obviously they would do that. And there's lots of information from the MS Trust, from the MS Society, and Shift MS also have a small video that they can watch and then make a decision as to whether they go ahead with that.
And if you are working in HR or anything like that and have questions, you can always contact the MS Trust as well and ask about things, because it could be things like moving your desk a bit closer to where the toilets are if you need to go, or quieter place and things like that.
Yeah.
Quite simple adjustments,
yes.
Really, isn't it?
And occupational health usually are very good within various employment, and also we would involve our occupational therapists within the wider community. And also there is disability employment advisors locally, usually at job centres, and they could involve them as well, or access to work.
Yeah, so there's lots of options for people if you are worried about it. Which brings me on to the last question. So what did you love about being an MS nurse?
I just love the variety. I just love the people that I would meet. Our caseload at Stoke is well over 3,000 patients, and I've met a lot of those patients, and they're the best patients because they've always got a really good sense of humour, and the variety of the work, one day is so different from the next day. There is so much support out there, particularly from the MS Trust, particularly with education, with information and support. There's the 1 week course that people can do when they're in the role, and that is brilliant. I didn't get that 21 years ago and sort of had to learn off the hoof, but there just are so many opportunities out there. And it's a really exciting time to become an MS nurse. A lot of the role is involved around the disease-modifying treatments, and there are more drugs that are being researched. So the future just looks so optimistic and so exciting that I would say, yeah, get on board. It's the best job.